morning, dear professor, staff members and colleagues. Our presentation today is about the Amnion. We will start with a case presentation of 21 years old male with no significant medical history, was exposed to a thermal burn. The patient complained of severe pain, photophobia, inflammation, and mild diminution of vision in both eyes, more on the left eye. This is a picture of right eye clinical examination. We can see a clear defect measuring 3 by 3 millimeters in the center of the cornea, with clear edges, no signs of limbal ischemia, and uncorrected visual acuity was 624 refractory. The examination of the left eye was a clear defect measuring 6 by 7 millimeters with clear edges, moderate case, 180 limbal involvement from 3 to 9 o'clock, less than 50% conjunctival involvement. And it was classified as class 4, ocular burn according to the classification, and corrected visual acuity was counting fingers 30 centimeters and refractory. Briefly, Dua et al. In 2001 has established a new classification for ocular burns. It has 6 grades regarding the visual prognosis and depends on 2 factors, 2 important factors, which are laser and conjunctival involvement. The management plan for this patient was the right eye, copious eye wash by about 2 liters of normal saline, topical antibiotics, eye drops, and preservative-free lubricants. This is a picture of the follow-up after 2 weeks, complete epithelialization of the right eye, and corrected visual acuity was 6.6. And the left eye treatment was copious eye wash with about 2 liters of normal saline and sweeping of the cornices, topical antibiotic eye drops, and amniotic membrane grafting by sandwich technique, plus a layer was covering the cornices, secured with 2 double-arm horizontal mattress sutures tied over the skin. And this suture was removed after 1 week. This is the picture of 2 weeks follow-up, complete epithelialization, improved limbal involvement, the ischemia disappeared, disappearance of the corneal opacity, conjunctivalization from 4 to 9 o'clock with no simple formation, and uncorrected visual acuity was 6.6. These 3 techniques are known about putting the amniotic for the epithelial defects in the cornea. The first one is only epithelial facing down. It helps the corneal epithelial growth, and it sloughs quickly. The inlay technique, the stroma faces down, and it acts as scaffold and useful in a large corneal defect. The sandwich technique is a combination of both, and the fornice is covered by a layer and secured by 2 double-arm mattress sutures. A brief historical background about using amniotic membrane. In 1910, Dr. John Davis used the amnion to cover damaged skin. In 1940, Roth used total fetal membrane to repair symplectrum in 8 cases, and suddenly in 1997, the big bang of the amniotic membrane has begun. Review of literature. The amnion is the inner layer of chorioamnion. It's composed of 3 layers, the epithelium and basement membrane, and stroma. It has 2 important types of cells, the amniotic membrane epithelial cells and the amniotic mesenchymal stromal cells. The physical and biological properties of the amniotic membrane: it provides a physical barrier, and it secretes extracellular matrix structures as glucosaminoglycans and different types of collagen, modulate the cellular migration and proliferation. It considers as non-immunogenic tissue, as it doesn't express canal markers. Also, it acts as anti-inflammatory, antimicrobial, and anti-scarring tissue. There is a debate about is it angiogenic or anti-angiogenic tissue, depending on the tissue that implicated on. The importance of these unique properties has been addressed in a recent review in 2022 by Huda et al., in which highlight the development of the amniotic membrane over the past 100 years. Daniel et al. In 2000 evaluated the efficacy of amniotic membrane transplantation for 13 eyes, 7 eyes with grade 2 to 3 ocular burn, and 6 eyes with grade 4 within 2 weeks. 85 showed complete utilization within 2 to 5 weeks, and the final visual acuity improved from 4 to 6 lines and 1 to 3 lines in 2 eyes. Grade 2 and 3 burns had no limbal ischemia, and all eyes of grade 4 has experienced limbal stem cell deficiency. Henrik et al. In 2017 conducted a retrospective study on 72 eyes who was treated with amniotic membrane transplantation from 1998 to 2008, in which 43 eyes were grade 4 and 5, and 22 eyes were grade 2 to 3. A complete limbal cell deficiency occurred in 33 eyes, and partial limbal cell deficiency occurred in 21 eyes. 29 eyes ended up with visual acuity of 6.9, 43 eyes ended up with visual acuity of 6.12 or worse, and 22 eyes ended up with a visual acuity of 6.60 or worse. Cornea et al. In 2021 conducted Cornea et al. In 2021 conducted a meta-analysis comparing amniotic membrane transplantation and conventional medical treatment in acute ocular burns. The conclusion was amniotic membrane transplantation in comparison with conventional therapy was beneficial in reducing corneal neovascularization, with no significance regarding formation of symblepharon, epithelial healing time, and tear film breakup time. He noted that most studies showed the beneficial effect of amniotic membrane in treatment of ocular surface burn. However, the main drawback was none of these studies had a control group. We could conclude that amniotic membrane transplantation is beneficial in grade 1 and 2 and 3 ocular burns comparable to medical treatment, best used with grade 4 and 5, as it reduces the corneal neovascularization and gives a chance for stem cell transplantation and penetrating keratoconus. There is no difference between amniotic membrane transplantation and conventional therapy in case of formation of symblepharon and tear film breakup time and epithelial healing time. Thank you.
دكتور حضرتك في تعقيب؟
هو طول بس هو الكيميكال بيلز اساس في التريتمنت هو البرايمري لينك والبرايمري تريتمنت اللي انتوا بتشوفوا العيان، يعني انتوا ممكن تغيروا حياه بني ادم بس ان انتوا تتعاملوا معاه صح من اول ما يبريزنت ليكم. لكن استخدام امنيتك ممبرين مهم، ومن الحاجات اللي هتبتدي تستخدم سواء هنحاول نعملها في بنك العيون. دي كانت رساله الدكتوره نانسي وفي معهد تخصص امراض العيون، وبالتالي عملوا بلان ان احنا امنيتك ممبرين هنهارفست عليه ستيم سيلز عامل زي الشيت، وبالتالي في العيانين دول في مش بس هنحط امنيتك ممبرين، نحط ستيم سيلز كمان، فده هيبقى يعني بريك ثرو. بس هو الاحسن احنا ما نسيبش الكيميكال بيرز بروجريس بعدين نتعامل معاهم، لان هم يعني فيري باد بروجنوسيس انترفير ليت للستيم سيلز الاساسيه. فهو لو احنا ما عندناش ستيم سيلز مهما هنعمل مش هنقدر نكمل.
الحقيقه ان ده ايرلي اتمثل، يعني بمجرد ما العيان يجي لو انا لقيته من جريد 2 to 3 او حتى جريد 4. جريد 4 انا مش هقدر اعمل لها ستيم سيلز ات ذا سيم تايم في نفس الاكتيفيتي، يعني during الاكتيفيتي بتاعت البيرن، لكن اقدر احط الامنيوتيك ممبرين ده بعد كده يحسن البروجنوسيس لما اجي اعمل له ستيم سيل ترانسبلانتيشن، هيقلل الفاسكولاريزيشن، هيقلل الانفلاميشن، هيقلل الكورنيال سكارينج ليتر اون. فديفنتلي الامنيوتيك ممبرين في حالات الكيميكال